So we are in medical terminology number 4. Persistent duct truncus arteriosus, failure to aorticopulmonary septum formation. D. Transposition of great vessels, failure of aortic pulmonary septum to spiral. TIT spills in tetralogy of Fallot, crying, fever, exercise, increase right ventricular outflow obstruction, increase right to left flow across a ventricular septal defect. Eisenmenger syndrome, uncorrected left to right shunt with increased pulmonary blood flow, remodeling of vasculature, pulmonary hypertension, right ventricular hypertrophy, right to left shunt. Atherosclerosis, endothelial cell dysfunction. This is the beginning of atherosclerosis. Macrophages and low dense lipoprotein accumulation. Foam cell formation lead to fatty streaks, smooth muscle cell migration, extracellular matrix deposition, fibrous plaque complex atheromas. Thoracic aortic aneurysm, cystic medial degeneration associated with tertiary syphilis. Myocardial infarction, rupture of coronary artery, atherosclerotic plaque lead to acute thrombosis. Non-ST segment elevation myocardial infarction, mainly subendocardial infarction. ST segment elevation myocardial infarction, transmural infarction affecting all layers of the heart. Death within 0 to 24 hours post myocardial infarction, most probably due to ventricular arrhythmia. Death or shock within 3 to 14 days post myocardial infarction, most probably due to macrophage mediated rupture, lead to papillary muscle within 2 to 7 days rupture, or interventricular septum between 3 and 5 days, free wall formation within 5 to 14 days. Wolf, Parkinson White, abnormal accessory pathway from atria to the ventricle, bypassing the atrioventricular node because it should go through the atrioventricular node. This is a normal pathway. Ventricles begin to partially depolarize earlier, lead to delta wave, ECG, and re-entrant circuit. Supraventricular tachycardia. This is supraventricular tachycardia. Hypertrophic obstructive cardiomyopathy, sarcomere protein gene mutation, lead to asymmetrical septal hypertrophy, sarcomeres added in parallel, death due to arrhythmia. Syncope, dyspnea in hypertrophic obstructive cardiomyopathy, asymmetrical septal hypertrophy, lead to systolic anterior motion of mitral valve, lead to outflow obstruction. Hypovolemic shock, reduced preload, reduced stroke volume, lead to reduced cardiac output. Cardiogenic shock, decreased cardiac output due to left heart dysfunction. Obstructive shock, reduced cardiac output due to blockage of vessels or structures outside the heart. Distributive shock, reduced systemic vascular resistance or reduced afterload. Rheumatic fever, antibodies to M protein cross-react with self-antigen. It's called, I think, mimicry, something like that. Type 3 hypersensitivity reaction. Deep vein thrombosis, stasis, hypercoagulability, endothelial damage, vercotriate, these three things, blood clot within deep vein. Most common congenital adrenal hyperplasia, 25 hydroxylase deficiency, lead to reduced mineralocorticoids, reduced cortisol, and increase sex hormones. Okay. increase 17-hydroxyprogesterone. Euvolemic hyponatremia with syndrome of inappropriate ADH, increased ADH, antidiuretic hormone, lead to water retention, reduced aldosterone, increased atrial natriuretic peptide, increased brain natriuretic peptide, increased urinary sodium secretion. Heat intolerance, weight loss in hyperthyroidism, increase in sodium potassium ATPase, which will lead to increased basal metabolic rate, lead to increased caloriogenesis. Myxedema in hypothyroidism, increase, I think, glucosamines in interstitial space, lead to increased osmotic pressure, increased water retention. Graves' ophthalmology, it's called Graves' disease, hyperthyroidism, type of hyperthyroidism, lymphocytic infiltration, fibroblast secretion of glucosamines, increased osmotic muscle swelling and inflammation. This is for today. Thank you.